Well, the Congressional Budget Office finds that the Senate GOP health care bill would leave millions of Americans uninsured. LA Care Health Plan was created by the state to provide health coverage to low-income residents in LA County. It is the nation's largest publicly operated health care plan.
And joining us to talk about the potentially dramatic changes is John Baackes, the CEO of LA Care Health. John, thank you so much for joining us. This is a very complicated subject, so let's talk about it. The Congressional Budget Office says about 22 million people will be without insurance. What do you think of that estimate?
Well, I think it's compatible with the estimate that we had for the House bill that was passed in May. But I think what that misses is that there are 74 million people covered by Medicaid. And at the heart of this bill, which has gotten very little attention, is that they're proposing to change how Medicaid is funded. So all 74 million of those people, men, women, children, developmentally disabled adults and children, as well as elderly people in nursing homes, are going to have less money for their coverage.
What do you think the chances of it passing are?
I'm discouraged that I think that they will come to some compromise and it could pass. And I think that's going to be a tragedy.
Right. And then, I mean, how can people possibly, if it does pass, to start protect themselves?
Well, first of all, the bill has a part about the individual markets, and there are about 12 million people in those. That's gotten most of the attention in the debate about pre-existing conditions and the rate ranges. And then on the other side, there was the repeal of the Affordable Care Act, taking back the coverage for the people who gained it under the Affordable Care Act. And that's in there. But what goes beyond all that is the idea that we're going to change how Medicaid is funded. For 52 years, the deal has been the states and the feds share the cost. If you read the bill, what it says is no longer is the federal government going to pay their share. They're going to figure out an arbitrary amount, cap it, and then going forward, it will go up at a consumer price index that has nothing to do with the actual cost of providing care. So that 10 years out, we'll be facing a 25% shortfall in funding to take care of these 74 million people. That is going to have ugly consequences.
Well, let's talk about LA Care Health before we run out of time. I want to get that in. And what does it do? 1 in 5 people living in Los Angeles are covered?
We have 2 million covered lives, all of whom are on Medi-Cal, and that's 1 in 5 people. We organize a delivery system of hospitals and doctors that are made available to anybody who qualifies for Medi-Cal or Medicaid and signs up for our plan. We take care of all the arrangements for payment, credentialing of the doctors, quality measures and standards, and our goal is to provide everyone with access to quality care regardless of their ability to pay.
Oh, wow, what a good service. John Baackes, thank you so much for joining us. And if you want to learn more about the LA Care Health Plan, go to their website at lacare.org.
So much to know about all this stuff. So thank you very much for joining us today.